simply that I was born without a full urethra that goes all the way through. I guess with all the surgeries when I was younger, I have flashbacks. I can't remember it wholly, but when I was younger, being in and out of the hospital for these surgeries, and one instance being at my cousin's house where the flow of urine actually stopped and kind of going into panic mode where I wasn't able to use the restroom, I definitely knew something was wrong there. The scariest thing about this whole situation was that it seemed to never take. I would leave the hospital, leave a outpatient surgery with the hope that it would be fine and I wouldn't have to come back. And then upon the next visits, over a certain amount of length of time, it just went back to the way it was. It didn't continue to get better. It got worse over and over and over. I believe it was 6 surgeries I had with the previous urologist, and it just didn't take. And it was frustrating. The hardest part of this whole process of surgeries was the fact that it seemed to never end. It was a long process. I wasn't able to talk openly amongst my peers, and I believe not being able to be open amongst friends and others that are your age was probably the hardest part, and keeping it a secret from so many people, having to, I guess, lie when you're not able to go out for a period of a week, 2 weeks after a surgery. That was the hardest part. With my previous urologist before Dr. Gelman, I believe I was around 11 years old, just entering junior high, I believe, where my previous doctor just felt defeated and gave us the name of Dr. Gelman to go see him and talk to him. And I think after that first initial conversation, things seemed to look up from there. He had more confidence than the previous doctor had with dealing with my, I guess, condition. After meeting Dr. Gelman, I believe the process began in around junior high, around 11, 12 years old. I can't remember the exact age. And after meeting with him, he was kind of detailing the different surgeries we're going to undertake. And it was going to be a drastic surgery rather than the small scrapings that I guess, received from the previous urologist. Essentially, the first surgery, they would just start fresh with a new urethra. They would let me go through puberty, ultimately finish puberty for the most part, and then redesign essentially a new urethra for me. And so in junior high, I had the first initial surgery, took a skin graft, and started growing another urethra. And then it was after puberty where the next surgeries began. During the initial surgery, hope was up because of the other urologists. I felt this one, after researching and doing some background on him, it kind of seemed like he was the go-to doctor for major urological surgery. So that kind of gave me hope. At the same time, there had been so many surgeries, I wouldn't feel perfect, I guess, until after it was all over. So there was always this thing in the back of my mind, just what if it doesn't take? But it was a little bit better working with someone who had the background as Dr. Gelman did. After the first surgery, the recovery had to have taken a few weeks. I remember being bandaged up for a while and having to change the dressings often. I believe it took at least 2 weeks before going back to the doctor to see him, to check out, make sure everything was okay, no infection. So it took a while. Of course, after that initial time, I had the length of my puberty to kind of make sure everything's healed, to grow the new urethra. After the second surgery, after the big surgery when the new urethra was attached and I went back into Dr. Gelman's office to see how my urine flow was. And they took out a suprapubic tube, which I had inserted. So essentially I was peeing from the, into a bag. And so as soon as they took it out and I was able to use my urethra to urinate, I felt much different, and that it actually worked. I felt like it actually worked because the flow was unlike I've ever had in my past. It's kind of embarrassing. It gushed out of me. So at that point, I knew I was good. After the second surgery, I was age 13 or 14, and now looking back at 22 years old, I still feel outstanding. Like, haven't had really any problems since at all. With my experience of doctors, I understand that there's a lot of good doctors, but there's very few great doctors. So with dealing with all these surgeries, I think I've found a great doctor in this type of field. And some who take the extra detail, whereas some doctors will pass off some of the small little details off, whereas great doctors want to make sure everything's done to their type of excellence. I can't think of a better word right now.
The hardest part for me during this whole 18-year process, actually, it was my inability to make him understand. As a child, their experience is very, very limited, and they think of the now and today and his fears, and someone will know, and I can't talk to anybody, and I'm going to be a freak, and those were the things that were very, very hard for me to deal with. And I felt very bad for him. And all I could do was just try to keep reassuring him that, just because you're different doesn't make you unlovable. And it took him a while to figure that out. And actually, it wasn't me who actually convinced him of that. I think it was his girlfriend when they reached that age. It's funny, I was listening to his comments, and you're right, they have a different perspective of what was going on, because you don't want to deal and you don't want to remember. I think most mothers feel guilty, like, what did I do, during gestation, that this, was a result of this condition for my son. Why can't they fix it? And that's what's so terrible. You have these surgeries, you're little, you're a year old, and subsequently, and then there's 5, and they don't know why. They don't truly understand why, and you can't do anything about it. From the moment he went through the procedures to check to see what he had to work with, I noticed a tremendous difference. He does his own x-rays. He studied plastic surgery to look at the differences in the healing and the results. And when he did to create the new tissue, he took a graft from Eric's hip. And it was the most amazing thing because it looked like a little net. And it was hours and hours and hours of stitching that he did to make sure that it all got adhesed so that there would be good blood flow. And what I noticed is on the wound where the graft was made, he hit the bandaging, as you call it, was different than anything I'd ever seen. It was gel-like, it was different, it was to promote so that it would have, again, a great result. So those were big indications to me. I have found that Dr. Gelman, because he's brilliant, and I would say that unequivocally, they have their own little world that they go and ring to, and they're always thinking, and so that was a differentness. He changed my life, not only because of my son, but he really opened up to me a reassertion that there's good people at everything. And my son had said it prior to me, but there's very few great people. And in certain cases, you need great people, and you will notice immediately. It's since then, I only go for great doctors. Anyway, I can't say enough about Dr. Gelman because, like I said, he changed my life, and I'm, in turn, been trying to change other people's life because family and friends are important and you want the best results. After what we've been through since he was born, what more could I ask?